Hello guys, welcome to today's episode of Awaken the Womb. Today we're going to unpack some of your most googled questions on IVF and fertility. Some people are so used to Google that they can hardly take instruction from their medical experts except Google approved it. So today we decided to bring those questions and their possible answers to your doorsteps. But firstly, if you're new on my channel, my name is Jed. I'm a fertility expert. I help couples get baby by guiding them through all the tests they need to do and letting them know the best approach for their fertility treatment. If this is the kind of content you are interested on, please hit the like and share buttons, and if you have any question, feel free to drop it in the comment section. So are you ready for these questions? Let's dive in. Well, the answer is not always. IVF success rates varies depending on many factors, but the most important factor is the woman's age. But that's not just the only thing. Sometimes it succeeds on the first go, but sometimes it doesn't. It simply requires perseverance and persistence. Do not lose hope. Firstly, let's talk about AMH, antimalarial hormone. It's a blood test used to assess a woman's ovarian reserve. Ovarian reserve is a term we use to describe how many eggs a woman has left. It helps us predict the kind of response to fertility treatment, more particularly IVF. AMH tells us how many eggs we would expect to get during an IVF cycle. With a low AMH, it simply means there aren't many eggs left. In an IVF cycle, the more eggs we get, the higher the chances. But that doesn't mean IVF cannot work with low AMH. IVF can still work with low AMH depending on the different circumstances. For example, a young lady with low AMH still have excellent chances of becoming pregnant. So AMH is not the only predictor for IVF success. Of course, IVF is the best option for male fertile infertility. Whether it's the count that is depicted in concentration in semen analysis, or the motility, which is the movement, or the morphology, which is the shape of the sperm, all these parameters, when they are abnormal, IVF can overcome them by selecting the best sperm and injecting into the egg, which we call ICSI, intracytoplasmic sperm injection. And the success rates with ICSI are excellent. So yes, IVF can work with low sperm count. Generally speaking, the process of IVF is not necessarily painful. Yes, it does involve injections, and those injections are not pleasant, but most women tolerate them very well. They are very fine needle, and they are just very superficially under the skin. They shouldn't cause much pain. The second part of the pains you might experience during IVF process is after egg connection. After egg connection, the ovaries are a bit more swollen, and there are blood clots in those follicles that are extracted, which can cause pelvic discomfort or even pain. And it's expected more for women who already have chronic pelvic pain or endometriosis. Also for women who have high number of eggs retrieved during egg connection. But pains can be managed and managed well. Women should not be experiencing pain during this process. There are good number of pain medication for women who experience pains. So let your doctor know if you are uncomfortable, so you can find a way of managing pains so that you don't feel any form of discomfort during treatment. Well, depends how you define surgery. During egg connection, most IVF providers, including us at Bella Fertility, the patients will go under light sedation. That means you'll be asleep, you won't feel anything. There is no cuts or incisions or scars involved. And basically, when you are asleep, with ultrasound guided needle, the follicles are extracted from your ovaries. So in that sense, it's not really a surgery, but a procedure. And to avoid pain, we help you by putting you under light seduction. Well, no. Absolutely not. IVF egg connection does not cause early menopause. In the process of IVF, whether it's for egg freezing or for the purpose of conception, we are basically rescuing eggs that are doomed for cell death. We are not depleting any of the eggs that you will have in future. Remember, these are eggs that will be going in few weeks' time. Anyways, so IVF egg connection does not cause any early menopause. Absolutely no. Some earlier studies found some association between IVF and cancer risk. But we know with later larger studies, there is no increased risk of IVF egg connection with cancer risk later in life. The question is it for long term or for short term? For long term, absolutely no. Egg collection will not impact your ovaries or your ovarian reserves. That is the egg you have left in your ovaries. But for short term, yes. When follicles are extracted, there are some blood clots that will be formed within the follicular space, which will lead to some discomfort or even pains. But these pains will probably be absorbed in 2 or 3 weeks' time. So, long-term egg connection does not impact your ovaries. This is the most common question we get. I don't even understand why it is the last on the list. Anyways, you may see a few more kg on the scale, but it does not cause a long-term weight gain. Most of the weight gain that is attributed to IVF and hormonal stimulation is associated with some more water retention during stimulation as a result of hormone, but this will subside anyway, unless the food is real good in recovering from egg connection, in which you may gain some kg. But normally, you do not gain weight from an egg connection over a long period of time. I hope I've been able to answer some of these questions that scares you away from approaching a fertility expert and knowing the best approach for your fertility issues. Thank you. See you on my next video. Bye.